Hello there. It's a pleasure to speak to you today. I'm Kirk Coury, and I'm in private practice in Amarillo, Texas. My presentation is Endodontics Reimagined, the New Shape of Clean. I'm a key opinion leader for Sonendo, and as such, I am compensated to speak about my experiences with the GentleWave technology. However, please know these are my opinions and experiences that I'll be sharing with you today. This presentation is centered around the notion of RE, which can mean in reference to, or again, or renew. Endodontics Reimagined is all about the new shape of clean that the GentleWave procedure is providing. It also marries thought-provoking synonyms such as reconsider, rethink, re-explore, reevaluate, and others. My ask for you today is simply to open your mind and look at things through a different set of lens and allow yourself to let go some of our legacy concepts and opinions and thoughts that we've created over the years that we have about our current treatment protocols and accept the challenge to recognize new possibilities and opportunities that are available so that we can reimagine endodontics and see things in a new and different light. Inasmuch as reimagining endodontics with GentleWave is about the new shape of clean, it's also much more than that. It's about revolutionizing our treatment, revitalizing our practices, re-engaging our referral relationships, and most importantly, restoring our patients' health. We're all familiar with the elegant and complex anatomy that resides in the teeth that we treat, thanks to Dr. Hess and others, and we've utilized best practices to obtain the best possible results using the best technology we've had available. Yet I think we can all agree that many times we're left wondering if we're consistently cleaning and debriding as effectively as we could be. After all, we know that this complex anatomy exists, and now with cone beam, we're more cognizant of the challenges inside the teeth that we treat, which with current traditional cleaning and shaping methods, we find ourselves forced to settle many times, hoping we've cleaned enough of the tissue, bacteria, and the toxins to successfully alleviate the patient's pain and create an environment for healing. Then there are those patients that return, and there we see on the screen the visually pleasing white lines of the radiograph, and the patient's complaining that their tooth is still painful. What went wrong? We know that the anatomy exists, but does it matter? And if so, when does it matter? Some of the time? All of the time? The answer is, I don't think we really know. So if we don't know, shouldn't we be erring on the side of clean as often as we possibly can? Imagine if you could snap your fingers and have at your disposal a tool that allowed us to implement a less invasive protocol where we avoid the use of over-tapered instruments and use fewer, if any, thereby allowing us to preserve as closely as possible the original canal anatomy, and at the same time, completely remove tissue and debris from the canal spaces, including all those little fins and anastomoses and irregularities. And in doing so, we could provide less postoperative discomfort for our patients, all in predominantly a single visit, regardless of the preoperative diagnosis and patient symptoms. Well, that tool is available, and it's called GentleWave. And because of its multisonic fluid technology, it thoroughly and effectively removes tissue and debris from even those smallest canals. That's where it shines. To date, my partner and I have successfully performed over 6,000 GentleWave procedures, and we can honestly say that it has revolutionized our practice on many different levels. This is an Instagram post that Dr. Gary Carr shared showing an SEM comparison of a necrotic case minimally shaped and cleaned with GentleWave versus conventional root canal treatment. The GentleWave case on the left is devoid of tissue and biofilm. You can see the sort of sandblasted appearance, which is basically the effect of the EDTA on the dentin and predentin. And it's an extremely clean canal. Now to compare to the conventionally treated case on the right, you can see tissue and biofilm remnants impregnated into the dental wall. Histologically, in this study by Molina's group, the GentleWave removed 97% of the tissue from the middle and apical regions when compared to conventional instrumentation and irrigation methods. In keeping with the theme of minimal instrumentation, what would happen if we advanced that thought further and asked the question, is shaping actually necessary with GentleWave? In this study by Wang and Hapasalo, they examined the canal anatomy of uninstrumented premolars after GentleWave, and the only file that was introduced was a number 10 to ensure fluid pathway. And in all 34 samples, they found no tissue after the GentleWave procedure. Because we're constantly evolving with this technology, and that's really what kind of makes it exciting, one variation in the technique sequencing that enhances our ability to achieve minimal to no instrumentation is what we affectionately refer to as the Phasor Protocol, mindfully created by Dr. Ryan Phasor. And here's the sequence. The canals are located and opened with the orifice instrument of your choice. And here's where things are modified just slightly. We build the platform and we initiate the GentleWave procedure right away before establishing the working length or instrumenting the canals. So there's a couple of ways that you can get to the final result. First, you can run the entire GentleWave cycle of hypochlorite and EDTA, and then get your working length and perform minimal to no instrumentation if the canal dictates that, and then rinse and dry the canals and obturate. Or you might choose, after the hypochlorite cycle, through the platform to get your working length, do your minimal instrumentation, and then run the EDTA cycle after that, and then rinse, dry, and obturate. Because we're using fewer and more often now no instruments, the protocol is more efficient, predictable. The platform provides a more reproducible reference point. It almost forces us to respect and appreciate the existing anatomy. Because no instruments go apically before the hypochlorite, this allows us to rethink some anatomical contraindications and maybe refer to them more as precautions, still to have situational awareness, but lessens our concerns. And this then really expands our case selection again, because we have respected the apical root anatomy and its intimacy where it approximates the critical structures. Because the GentleWave procedure can and does effectively remove tissue and debris to the apical foramen with minimal to no use of instruments, there's no need to use these sequentially larger and over-tapered instruments to prepare the roots that potentially hurt the roots more than it helps, just to accommodate traditional irrigation tips. And because the mechanism of action of GentleWave is so effective, it can even go beyond what we're capable of doing with conventional instrumentation and irrigation protocols. And for the first time, we are able to consistently clean the debris, those little intricacies that we've talked about within the roots, without violating the root's integrity and architecture. And you can see this evolution in the look of the completed cases. They're much less tapered. In fact, one of the very first things we did when we began using GentleWave was we informed our referring doctors that the look is going to be different and why. And with the notion of less is more, we inherently improve the long-term survival of the tooth based on just one variable alone. This is a good comparison of shapes before in number 18 and after GentleWave in number 19. This is a case that was referred to me, and I call it my aha moment. She was an elegant 85-year-old woman, and she really wanted to save this tooth. And in fact, I told her that based on my diagnostic tests and radiographic evaluation, that this really wasn't a good tooth to save, but she didn't want to hear that. And I told her she had plenty of good bone in front anterior to the tooth, that she could have some implants, but that just wasn't in her thought process, and she didn't want to do it. So I sent the report to the general dentist. About a month later, the dentist called me, said that the patient wants to get the root canal. And I explained to him why I thought it was a waste of her money. And he said, no, she wants to do it. And don't you have that new GentleWave thing? Why don't you try that on her? I accessed the tooth, and I could not establish working length. I could not get patency. I went through several. This is when, my legacy concepts were requiring me to get patency, and I couldn't. And so ran the GentleWave, and this was my result. And I was just astounded. And this was my aha moment when I realized this technology really can do things that my conventional instrumentation and legacy thoughts and concepts will not accomplish. The mesial aspect of the distal root, no instrument touched that space, but yet it was cleaned enough to capture it in the obturation. And then my aha moment was reinforced and solidified 7 months later when I saw this. She is a walking billboard for our practice and for GentleWave. This is another case my partner did, very extensive bone loss. and the patient really wanted to save the tooth. So he did a working diagnosis where he accessed the tooth, did not find a fracture, so went ahead and treated it in a single visit. And you can notice the MB2 that was obturated but not located, but was cleaned with GentleWave. This was 3 months post-op. You can see the extensive regeneration of bone and healing. And this is 6 months. And there's the post-op. Overprepared canals are a thing of the past. And with GentleWave, let's look at different ways of doing it. Radicular dentin is preserved and appreciated. This really is the new shape of clean. Embrace the challenge, trust the technology, and you'll see for yourself what it can do for not only your cases, but also your patient experience. This is just an example of our evolution of the use of instruments as we evolve our protocols. And then this one was just 1 year apart. Again, a continued evolution of minimally shaping and obturating the space. This is a case of a referring dentist wife. I originally treated in 2008, and then I retreated it for her in 2012 because she was having some vague symptoms and they were going to replace crowns. So I went ahead and did it for her. She returned in 2016 with the same discomfort, but I couldn't determine where it was coming from. And so we suggested a crown on 31. Well, then in 2019, she returned with significant pain localized to number 30. I prepared her for extraction and we decided to go ahead and retreat it. I just had GentleWave for about 8 or 9 months. So we accessed it, which was no small feat, going through all that porcelain and landing in my original access. We removed the gutta percha, did not detect a fracture, and we ran the GentleWave. And this is what we discovered the third time. I found a lateral canal into the lesion, and you can see 4 months later, it was completely healed. And then within 24 hours, she was pain-free. Again, she's a walking billboard for our practice and for the GentleWave technology. So let's revisit the question, does anatomy matter? If it matters even a little bit, then in my opinion, we should be utilizing any and all techniques available to help us achieve the best treatment results that we can and do for our patients. That difference, even if it's subtle and slight, it could very well mean the difference between extraction and saving a patient's tooth and returning it to full function. So from our perspective, these are the things that matter. GentleWave's allowed us to complete more cases in a single visit, regardless of preoperative symptoms. And with COVID, that was never more important than it was during that whole time frame. And this technology works simultaneously in all canals. It preserves more tooth structure because we instrument less. And because we instrument less, that means where there's a cost savings in those instruments. Anytime hypochlorite's involved, we have to have confidence in the technology safety, and GentleWave is beyond safe. I wouldn't hesitate to use it on any of my family members. We've performed over 6,000 cases to date at Amarillo Endodontics without a single accident, and that makes it safer than positive pressure needle irrigation in our practice for sure. GentleWave provides a positive patient experience, and one big part of that is less postoperative discomfort following the procedure. Retreatments, pre-op, apical periodontitis, you name it. When I use GentleWave, and I do on 99% of all my cases, I have confidence knowing that the patient will have a favorable outcome. Canals are cleaner, particularly in teeth with known complex anatomy. This is important because it gives me peace of mind that I did enough. With GentleWave, it's 7 to 8 minutes of standardized treatment. If we can standardize what we do before and after, then the workflow efficiency with GentleWave becomes very effective. With aerosols on everyone's mind, the GentleWave produces virtually no aerosols whatsoever. One of the biggest things that's occurred is rejuvenated and revitalized our practice. We actually look forward and have fun doing endo again. It's given us something new to talk about with our referring doctors. And because it is so effective, we're seeing more referrals, not only from dentists, but from our patients as well. And lastly, it's relevant to what we're trying to accomplish in endodontics: preservation of tooth structure, more thorough debridement, and saving teeth while providing a positive patient experience and outcome. GentleWave has been around long enough now, and with well over 550,000 procedures performed by 750 plus clinicians, I think our results speak for ourselves. If you haven't done so, I'd encourage you to put away your biases, assess the technology based on what it can and does do, and form your own opinion. There's no way you're going to walk away short of amazed. 750 plus of us can't be all wrong. So we end where we begin. GentleWave is revolutionizing endodontic treatment, revitalizing our practices, re-engaging our referral relationships, and restoring our patients' health. And it all begins by reimagining endodontics. Thank you. I appreciate your time.